my beautiful ones. I am so happy to have you. Thank you for sticking with us. Thank you for being such a loyal audience. And today is a special episode. You know, I am a holistic nurse, and I have to pull my other holistic nurses into this space. We are all for nurseology, we're all for this bioholistic model of nursing. And we're not just going to talk about it, we're going to show you. So I have the lovely Debra Reis. She is an empowered nurse, and I am welcome. I'm welcoming you into this space.
Oh, thank you so much, Casey. It's beautiful to be here. Thank you.
We have some treats. I have so many questions for you. But as holistic nurses, there are a few things that we do to empower ourselves. Now, you are the empowered nurse. What does that mean?
Right. Well, I think as an empowered nurse advocate, I have seen through my 35 years of doing nursing how important our holistic practices are and how we as nurses act as advocates, but also, we are advocates for our patients. But what I have discovered as I've been moving into my journey is how important it is to advocate for each other. And that has been missing, so much in our practice. And I just feel that, we really need to look at yes, definitely our patients are important, but if we're not in a good space and a good place, then how can we be that advocate and how can we be empowered ourselves if we're not taking care of ourselves?
Now, this is perfect because if our viewers were with us last week, we had a nurse. She is studying to be a lawyer, but she is an advocate and she's always talking about how to protect her license. And she's always there at the board advocating for nurses to retain their license when they're in water. But this is a different type of advocacy. This is a different type of empowerment, one that we all need. And that's taking care of each other.
Right. So if you want, we can get started with kind of like a centering practice to get ourselves together and in that space of being advocates. Oh, yay, good. You know how much I do it. I do the 3 pillars, the relaxation therapy, aromatherapy, and movement. So we're going to start first with some relaxation therapy with breath work. And I think breath work is so important to help us ground. And the other thing, I think when we as nurses, we are really very busy. We're in busy settings. And it's important that we have tools for ourselves that we can bring ourselves to a place of balance quickly, in a matter of seconds. Yeah. So this is one tool we can do to kind of help ourselves center, ground, and get us back to that place of balance. So I encourage you, just as you get comfortable in your chair, just to bring your awareness to your breath. And I invite you to breathe in through your nose to a count of 3 or 4. And breathe out through your mouth to that same count. Now, as you breathe, allow your lips to be parted as you breathe in through your nose to your count. And as you breathe out through your mouth to the same count. When you part your lips, your jaw and neck relax, and your entire body will follow. And you can add your word or your intention. So breathing in joy or peace, and breathing out whatever you wish to surround yourself with. And during this time, it might be something like peace, balance, that we share with each other. And we'll add to this practice in a little bit. But for now, let's just allow your out breath to slowly bring you back. And it's a good reminder for us as to how important breath and mindfulness can be to bring ourselves back to balance quickly and effectively, even when we're in a stressed situation. How do you feel?
That feels so good.
Mm-hmm.
Feels so good. I feel so relaxed and calm.
Yes. Right. Me too. Me too. And it's so good to start that way when we're, when you're doing any kind of speaking or as well as when you're in the middle of your day, it's a really quick thing you can do for yourself.
Yes. I often lead my nurses. I work as clinical manager in the hospice space.
Mm-hmm.
When we're together in the interdisciplinary group, I often lead them through breathing. And sometimes I wonder on the other end, I wonder what they're thinking about this.
Yes. Yes.
It feels so good as you are leading me through it. I feel so good going through this.
Yes. Oh, good. Yes. Right. And we do need that for ourselves because we are advocates and we are helping others. And we sometimes are last on the list, or it's like, wait a minute, I've got to get myself back into this place of balance. So that's kind of like, as women, as nurses, we tend to do that.
Yes, and this broadcast goes out on LinkedIn. That's where the home is,
Mhm.
and we
Right.
have a lot of nursing leaders, either in the clinical leadership or in academia. And I think that as as a holistic nurse, I would love for us to weave these practices into their, not just because they know it, they're intelligent, they have done all the studies, but into their practice when they are having overwhelmed times. I want them to know that this is something that they can do.
Right. And that's exactly what my iStep program, which is Integrative Supportive Therapy Engagement Program, is really meant to help team building in healthcare organizations. Certainly it can be used elsewhere too, but my focus as a nurse, being a nurse, work and really advocating for nurses is what can we do to help our team? And I started using some of these principles from the 3 pillars I mentioned: relaxation therapies, aromatherapy, and movement therapy. I started as a pilot program. And the reason the nurse manager brought me in was because she had a 40% turnover rate. It was a small unit, but what 40, doesn't take many people to really, shake up your whole department. And that's what we're kind of seeing still. We're still seeing around a 30% turnover rate within many of our organizations. And still nurses are saying, over 70% are saying they're emotionally exhausted. They're really, just fatigued. And so part of what they're looking for are things like continuing education, support models that can help us with that. And these tools are perfect in helping bring team resilience, team cohesiveness, as well as individual nurse balance. But also it's learning tools, not only for yourself, but then I can use that for others. I can use it for a team member. I can use it for a patient. I can use it for my family. So it really is. And with this group that I did the pilot, they reported back, sleeping better, finding different tools that help them, like doing happy feet where they could get up and do little stretches, at the top of the hour, and, just a few minutes, but it gets the energy moving. It gets you more awake and it just makes you feel better. All those endorphins are rolling again. So just those simple, quick, silly, yet very effective kind of techniques that we can do, as well as create team building.
And I think that's really important because I remember actually on my journey, I didn't even know, but to become a holistic nurse, one of the units I worked on in the hospital was post-operative, and we all had our aromatherapy kits that we would use. And I really loved it because I would give before I grabbed Zofran, I would give them the Zofran and I'll give them the little we put it into the medicine with a little
Yes.
ball, and I had my little ginger.
Yes.
Lavender.
Perfect.
It would, the whole room, and you wouldn't believe, a couple of drops of essential oil, but their whole room would be smelling like a football.
We put it on a tissue like this. We fold it up and put it on a tissue. And in the center I'm working at, we will give this, yes, to patients, but we make sure the staff get, if they want something, they also get something like this as well. And during COVID, our staff became our patients. And one of the departments, the ER department, which, you know, I've come from critical care, and I know that ER nurses, critical care nurses, sometimes they're a little tough on, you know, saying, oh, this is going to do something. But the nurse manager actually wrote us back and said, this was powerful. It was so interesting as they're breathing different aromas. Think the comments, the lift of the mood, laughing, and, you know, and being together, promoting togetherness again. So that is so, so important. So yeah, it's something you can blend with by itself or blend with other modalities.
You know, sometimes, and I would say this because I know you have a program, and I'm so happy you are a part of my network, part of my community, because a lot of nurses will come up to me and say, Casey, I love using essential oils. Like I have here eucalyptus.
Yes.
And then I have some lavender. And so many leaders would say, wow, how could we introduce this? How could we get a program going for our patients, our families, and our staff?
Yes.
But a lot of times they don't know, well, how do we start or where do we start? So how could we get this aromatherapy, how this relaxation and restoration, how can we get this revolution going through our clinical partners? Do you have any idea?
Yes, I can tell you. I mean, we did bring in aromatherapy to our center, to our whole organization, actually, and we are multi-centered. Yeah. So, so we really did some research. We looked at, you know, what companies are, you know, looking at their policies, looking at, you know, how much information are they sharing? So we looked at many things. As a certified clinical aromatherapist, I really feel safety is extremely important, and that we should know what aromas we're using and how it might interfere with a condition or with medications, things like that. So we do talk about a lot of that. And the program I do offer goes into some of that as well. What to look for, how to vet a company, how to look at different conditions, and what areas are you focused on? Where do you want to bring this? We brought it into oncology first, and then looked at patients and families, but we started with our staff because they're the real people who are going to promote it. They're on the front line, so to speak, when the patient comes through the door. You know, they're being greeted. So even the people at the front desk, they have their tissue, they've got the aroma, and as soon as a person comes through the door, they're getting a whiff of that. So they're getting the experience right away.
You know, being very vulnerable. So it's been a year I've been sitting on the Florida Center for Nursing, the Wellbeing Advisory Group. I didn't even realize it until LinkedIn popped up and say, it's been a year. And I really, you know, my last comments to the group, you as nurses, we are so intelligent and we can study the research, we could bring in the models, all of the things. But if we ourselves, the people, are not having it as part of our daily practice, it's really hard to bring that transformation into the systems that we work.
Absolutely. Right.
So my question to you, Debra, after being a nurse for 35 years, I know you've seen all the different types of nurses, all the different, we have different personas and different archetypes as a nurse. How, and just in your experience, so from your vantage point, how do you think we can get this holistic model really going? What do you think our profession needs to get the buy-in of really embodying this holistic nursing, not just knowing about it or writing about it through a case study?
I believe we have to get the information out as to what different models are working, how they are working. There are some really good, the really good models, programs that are out there. And a couple of those brave nurse administrators are saying yes. And when they do that, I think then making that information public as much as we can through articles, through and also letting our organizations, our administration know these are evidence-based practices. Breath work, aromatherapy, guided imagery. These are based on science. There are scientific evidence behind these modalities. So, it's not just a feel good, and something that there's some real evidence behind, and there's really some definite outcomes that we have obtained. So, I do feel that we have to speak that language. We are bringing things into organization. And we also have to speak the language of how is this benefiting them. For the nurse manager that I first started with, it was benefiting turnover. Turnover is money. Yes. That's what, we have to speak the language. And if we can bring in greater team cohesiveness, if we can bring in greater emotional stability and education, that's going to retain our nurses. And that's something we want. We've got new nurses coming on and no mentors. We need mentors. That's and mentors are, they get burned out. I mean, what many of the inpatient units with average, after 5 years, they're gone. Yes. That's something we want to hold that knowledge, and we want to have that mentor, wisdom in our unit and with those new people who are coming on board. But we have to make it so there's incentives and things like caring and sharing. That caring attitude is something that that speaks to people. That speaks volumes. And we've already said, nurses have already said this. Yeah, more money is great, but if you don't care about me, that's not going to keep me.
Yeah.
Throwing food at me and all that kind of stuff. Well, that's nice, but that's not going to retain me. We really have some different values now as far as nurses, as to what we want in order to, from an organization, from a department, from management, in order to be retained, to be here, to stay here, and to be part. And I want to be empowered, and I want to be a voice for what's going on in my unit, because I'm the one here.
Yes.
And, that's the one aspect that we don't always see that happening with nursing.
I'm so passionate for holistic nursing, and my bandwidth is only but so much. I can only do but so much. But having a vision for nursing, I really believe that every unit should have a holistic nurse, and should have as a center, as a ground, someone who can lead. Because even if you invest in a program, or our network, we can come in and we can teach them, but you need the buy-in. You need to have someone there who is going to keep things running. So I really think every unit should have a holistic nurse, or nurse who is comfortable with holistic modalities to temper the environment and bring the emotions back to central. But that's just me on a back.
And I totally agree with you. And I think part of, what is included in the iStep program, and I know there are other programs too, is really like train the trainer. So, having that nurse leader who really embraces those holistic concepts, like you're saying, those holistic concepts, but they aren't sure, how do I go about, delivering? So we are there to help in that, in that process of here's some tools, here's some templates, here is a resource. We have this resource that you can come back to make sure you're not just handing them tools and say, okay, we're done.
Right. True.
It's important that we have community and we have that connection. Like we were talking earlier, it's just so great to be connected again, and know that we can always come back to those mentors that we have, and And I'm so grateful that they're so willing to share, that you are, and others are so willing to say, hey, yeah, let's talk about that, or let's, share that info. That's so important, that we stay open. Oh, I don't, and not be like, oh, it's mine. But
yes,
let's,
no, and it can't be. And I think for so long as nurses, we came from that where we didn't truly help each other. And I think the
agree.
culture is shifting, and so many amazing nurses are coming in saying, we don't want to be like that. That is not the legacy we're leaving. Let us empower one another. Also,
Yes.
from holistic, some people might say, oh, that woo-woo stuff, but realizing that everyone has their wheel. So not everyone is going to be a holistic nurse, but
Right.
I'm going to tell you, one of the best nurses who I've been working with, she was actually my trainer. But she said, Casey, when you came in with all that deep breathing stuff, I was rolling my eyes. She was like, yes, I was the one. You were like, breathe deeply, and I was not doing nothing. But actually, after I had my child and I went back, and she was
Yeah.
like, I cannot go without meditation. I would not be at this job. She told me, she was like, people might laugh because I was one of them, but it works.
Yes.
Yeah.
Yes. And that's very true. And I've had different nurses come up and say, because we will see nurses as part of our practice. And, I've had people who are saying, I am so angry and I am going to explode if I don't do something. And I'm like, come on in. We need to do a little bit of session. And I get it. We are dealing with a lot of chaos and bombardment, and it's difficult to handle that. But knowing that there is somebody you can go to, and there are tools that you can get. And I think it's important that we integrate these tools. I don't have time to pull out a handout or try and find it on my phone app. I need to have it within me. And that's what I feel is so important when we're talking about different modalities or different tools, that we really look at learning the tool. Now, how can I use it quick?
Yes.
And myself back to balance. And that's what's important.
I'm telling you, Deborah, I love seeing it, especially the physicians. They wow me because they're like, I say, let's breathe. They say, oh, yes, let's go.
Oh, yeah. Yeah, we're having.
We love it,
They do.
You say it correctly. It's an embodiment. There are a lot of apps, but it really does not replace the being. Nurse Blake, he had a few of us go take some nurses from all around the country, and we took them to camp, and it was out in nature, and we pulled them through all these. And you think everybody knows this stuff, but they were so blown away. They loved it so much. They loved the music and the meditation, the breathing. They just loved it. So I think there is such a need for this work that we're doing, Deborah. I don't want to talk too much, but I know you have a third strategy, which as nurses, we move a lot, but yet we don't. We move a lot, but yet we don't.
Yes.
So you talk about your third pillar.
Yeah. Yes. Oh, and it's probably one of my favorites, I have to say. Yeah. So I just love it because there's so much that we can do with movement. It can be something very simple, like I mentioned, happy feet, just getting up and moving your feet, or, and just getting and standing up and sitting down, standing up, sitting down. And you can do that with, with your, with music, or just, just be silly with each other and just say, okay, happy feet time. And I had one of the units, they would do that. They would say, okay, happy feet time at the top of the hour. And the patient started getting into it, where they were like stretching or moving their arms or moving their feet up, that kind of thing. So, but let's you want to combine some of the three pillars. Would you like to do that?
Yes.
So, let's do it. We talked about the tissue with our oils. So let's put a drop of your favorite oil. And those of you who are listening, if you don't have an aromatherapy, you can always put your intention to have an aroma that you're smelling. And as you are breathing this in, I invite you again to get comfortable. And sometimes you can kind of put it on your chest or in a pocket, or, where you're going to smell it quite often, or you can just leave it next to you and it will definitely come up to your nose and to your entire being. But as you breathe, I invite you to settle into your chair, going back to that breath work we started with, breathing in through your nose to your count, your intention, breathing out through your mouth to the same count, what you wish to share. Having your lips parted to relax your jaw, your neck. And now we're adding that aroma. And breath. And now as you breathe, keeping your eyes closed, or if you want to open them softly, just gently move your head, your chin to your shoulder, side to side, like keeping your lips parted so your jaw stays relaxed. Maybe the inhale, you bring it to the chin, to your shoulder. The exhale, you bring it back to center. Inhale to your shoulder. Exhale back to center. Inhale, tuck your chin to your chest. Exhale and leave it there. Just really feel your shoulders relax. Feel the stretch in your neck. And then inhale, bring it up. Maybe if you feel comfortable, you can look to the ceiling and stretch. Now, if your lips are parted, here's a fun one. Take a bite, like you're biting the grape. And you'll feel that stretch in the neck. And then just bring it back down to center. And then take your arms and stretch your arms behind you. Breathe in that aroma. Exhale, give yourself a hug. Tuck your chin. Feel the gratitude for who you are, for the love in your heart, the love you share, and the love you have for yourself. Breathe that in. Exhale and bring your hands to the center of your chest, what we call our heart center. And feel that intention, what you have set for yourself, that joy, that peace, and maybe a memory that reminds you of joy or peace. And take a big breath in of that aroma. And as you exhale, just know the next time you might be feeling stressed or chaotic, all you need to do is breathe in that aroma or touch your hands to your heart or give yourself that energy moving hug that reminds you of the love that's within and around you. When you're ready, just slowly bring yourself back to the room. And you can give yourself a big stretch. This is one of them we do a lot. We'll do a big stretch. And sometimes we wave it around. There's other actions we can do in our chair and stuff like that. But this is something you can do very quickly. And you feel energized. You feel awake and alive. Yeah. Yeah. And that's great. Feel alive.
It feels good. It makes me want to walk around work with just some oils and a tissue.
And then just bringing this with you, breathing that in is a quick reminder of, okay, I'm back to balance, because it reminds me of being in a place of peace or joy, whatever that aroma reminds you of.
I love this. Yeah. So nurses are looking in and they're like, wow. So they have a question and they say, I feel silly doing this. Like I can do it in a group, but doing it by myself, I feel kind of silly. What would you say?
I would say there are many places that you can do this and nobody will even know you're doing it. If you're feeling a little self-conscious, and I understand some people are very more introverted, you know, you have your tissue and you breathe it in and you're walking down the hall and you're just kind of stretching, nobody's going to think that's anything silly. I mean, you have to move. You have to stretch to get from one room to the other.
Yes.
If you are touching your heart before you go into your patient's room, that's just a, oh yeah, it's just kind of like, kind of getting myself grounded. And as I'm looking at my notes, nobody has to realize I am doing this with intention. And the more we share, I think, the more that it is good to do. But I will say, that's how I started. I was afraid. I was kind of in the closet about sharing my, what I was using to help me. But my colleagues started to notice, and they started to say, you're in this very hectic environment and you're able to keep yourself cool and you're able to stay calm under pressure. How are you doing this? And it's like, I'm using my energy therapy. I'm using my breathing. I'm using my aroma. And it's like, well, what does that mean? So people start, they will notice and they'll start asking. And I realized then I had to share. It was not ethical if I didn't share. You can choose not to receive it, and that's okay. But if I don't at least share that there are strategies for you to be in balance, you can do it very quietly, effectively, or you can shout it out and share it, and that's fine. It's really meant to be what's best for you.
Amazing. You are such a powerhouse, and I thank you for developing all the programs that you have. I would love to see them roll out throughout the United States. I would love to see
thank you. I would love to share them. Yeah.
So if someone is thinking, I want to do that, I want to be that person, I want to be a holistic nurse, do you have to become a board certified holistic nurse to use some of these modalities?
You do not. And that's a great question, because I know a lot of times people are asking, do I have to go through all of this other kind of education? I think it's great. I mean, I really think those are wonderful foundation, but you don't have to do that to use to use these skills. But I think in doing so, you really do form a community, and you do have your own like support group that really you can share and you can learn from each other. And that's so important too.
Question for you, Debra. When you've been a nurse for a very long time, when you are doing these modalities, how does this translate to your patients?
As far as doing the modalities with the patients?
No, yourself. Because you're coming from critical care. You've been 35 years a nurse, and so many times as nurses, we are quick to do things for our patients, very slow for ourselves. Very slow for ourselves. Have you seen where the patients could tell the difference between some of the nurses who use the strategies and who did not?
Oh, absolutely. Absolutely. Yes. And I've had patients tell me that as well.
Okay.
That they really do notice a difference from how a nurse might interact with them. Are they interacting? And, one of the things we talk about is task touch or caring touch. And really, that's what they're identifying. I can tell when somebody is coming in just touching me to do a task versus someone who's coming in doing that same task, but coming from a caring perspective. It's really intention. And that's when I kind of mentioned it, like before I go into my patient's room, I just kind of touch my heart. What am I here for? This takes seconds to remind me before I go into that space.
It's something that I really would love to see extended, not just to registered nurses, but to LPNs,
yes,
to CNAs, to aides, because think about it. You have a patient that is agitated and you need to get vital signs or whatever task you have to do. And most times it's a tussle, it's a tussle of whose will is going to get done. But when you're coming from this caring centered place, your work almost becomes automatic.
Right.
It's like you said, it's a caring touch. The energy is different.
It is. It is. And, they do notice the difference. And I think we also, I mean, we notice the difference when
We
someone
do.
is, caring for you, you
Yeah.
notice the difference if it's sincere or if it's
Mm.
just to get the task done because I got to go to the next task. So it really is a mindfulness, a sense of that.
Something that's coming to me is the difference between the touch of a massage therapist versus someone, a phlebotomist. They
Yes.
will touch your arm, but it's a different way they're touching it.
Exactly. Yes. But I mean, you can also teach people who are doing these kinds of procedures how they can do that from a place of caring and a
Yes,
place of intentionality, which sounds very simple, but it is extremely profound.
it is. And I think the revolution is starting with us.
I do.
I think the way you amplify the difference between the touch is everybody knows what you're talking about, in that whether you're clinical or not,
That's
when someone has an intention to touch you with love and care,
right.
remind you that you are a person,
Right.
not just a patient or a room number.
Right.
Um, and then when you are being treated like a room number.
Yeah, absolutely. You absolutely do. And, and it's just a reminder for us because I know we're human. We get caught in stuff that's happening around us. And it's a reminder, even if we have to remind each other, it's time to just take a moment and center.
Yes.
Take a moment and just get yourself back into a place of balance. And let's share a tool. Let's breathe together. But I think that's something we can really show as far as caring for each other, is just recognizing when we are out of balance, we've gotten caught up in all this stuff.
Yeah.
And it is a true friend, colleague that can bring us back and say, you know what, just take a moment and breathe. And, we do, you mentioned not just the RNs, we really do extend this to our entire staff. So those from the medical assistants to those who are in the office, who are our office clerks and more, it's open to them as well, because we're all working together. This is truly a team effort. And so I want everybody to have those types of tools and strategies that they can use to make themselves better. And in doing so, it makes for a better team.
I love this. And I love this as well, that you can do it virtually, because that's how I met you, was through a virtual program.
Yes.
Or you can do it in person. I love this.
Yes.
I love everything you're bringing to our profession. It is of the future. Beautiful.
Mm-hmm.
I have another closing question for you, just to get your brain a little bit. If you were able to have the tools, the resources, and the power to transform healthcare, what is one powerful change you would bring to healthcare?
I believe nurses knowing their value and using their voice collectively.
Mm-hmm. Yes.
I think that would transform healthcare very quickly, because we do know what is needed. We do know what's out there. It's really coming together to show and share. We do have a voice. We do make a difference. And knowing, that's where I think that we kind of miss the mark, knowing that we are a valuable asset. We are valuable, as to that whole team. Without the nursing team, healthcare doesn't happen.
Mm-hmm.
And that's where I really want to see the vision change, is from a sick care system to a true healthcare system. And that's where I think our holistic principles and techniques can really help lead us into the future of what should be true healthcare.
Yes, true healthcare. Well, you have been such a pleasure. I'm so zened out because I'm smelling this lavender.
It's like, I feel really good. Yeah.
I am lavender.
It's a great thing to be high on.
My whole mood, I am so tranquil. I'm so
Yeah.
calm. And with
Mhm.
that calmness, I can really have gratitude for you, have
Mhm.
gratitude for you coming on the podcast, sharing with our world
Mhm.
of nurses here on LinkedIn. Just if they walk away with nothing, you taught us today how to relax using the power or the tool of our breath. You taught us today how to relax with some aromatherapy added to the breath. And then
Mhm.
you built on that by showing us some very quick, easy movement that just about anyone can do
Mhm.
anywhere. That doesn't
Right.
take very long. So you
Right.
certainly poured value into us. And audience, I asked her my questions. I got a little treat. Do you have any comments for Miss Deborah? Do you have anything that you would like to ask her? Do you have anything that you would, if you want to implement this into your healthcare system, reach out to her. If you don't have her information, connect with me. I will connect you with her. And let us do this together. It
Yes.
doesn't, you don't have to be by yourself. If you just like the idea, all it takes is one person asking your leadership, can we bring this? Can we make this possible? And a lot of times it doesn't even cost as much money as they may think
Right.
because you just want to start. You just have to start somewhere.
That's right.
So if this touched you and you want to do this, I would recommend that you reach out to us and let us support you because this is our vision and we share a collective vision to bring this beautiful practice to your workplace. So thank you, Deborah. Thank you,
Oh,
audience.
thank you. My pleasure. Such a joy to be here. Thank you so much.
Yes, we will have you back again. And for the audience, please leave your message. If you're not yet subscribed, subscribe to our channel. We are on LinkedIn and we are on YouTube. The Spark is Love. Meet the experts. We love to hear your comments and your feedback. Until next time, we will see you. Please take care of yourself.